hair transplants. You know, for women losing their hair and for men who just aren't ready to go bald, there is new hope. Joining me now is our plastic surgeon, Dr. Elie Levine, and Dr. Jody Levine, our dermatologist. Welcome back. Good to see you guys.
Great to be back.
Now, a lot of people don't realize, really, the dermatologist is the first person people go to when they start to lose their hair, right? Do you see a lot of that?
Yes, we take care of hair, skin, and nails. So I see a lot of people losing hair.
And at what point do you say to someone, you might want to consider a hair transplant, like who versus someone's just have a little hair loss?
Right. I usually don't bring up hair transplant as my first remedy. We discuss medical treatments,
right,
but usually it's the patients who ask about the hair transplant.
So they're coming in and they have that interest. But,
yeah,
you know, I have to say that hair transplant surgery has kind of a bad reputation, right? From the past, we've seen the people that have what they call the doll's hair or the corn, rows of corn, they call it.
Right.
How has it changed from back then?
Yeah, it's so different now. Right now, the way we do hair transplant, we transplant 1 or 2 follicles together, so you don't have these big clumps of hair, and it looks completely natural.
Right, and it's for a permanent solution for many people.
It's one of the few procedures where we're intentionally asymmetric. So when you're doing typical procedures, you really want symmetry. If you're working on the face, if you're working on the nose, if you're working on the chest. But when you're talking about hair, you want it to be asymmetric because that's what natural hair looks like.
Yeah, and I mean, the before and afters are really dramatic, especially when you're looking at the hairline. Like if you look at that picture there, you would not believe that that was the same person.
And that's the whole idea behind this, is for someone just to look good, not to necessarily have the telltale signs of having had a procedure done.
All right, so when you get this done, how long does this take? So you come in for the procedure. It doesn't happen overnight. It's like, oh, look, this would happen in a week, right? So what's the procedure really like?
The other thing I want to mention about that picture we just saw is that was done with NeoGraft, which is a new procedure. You don't have to take out a big strip of hair. There's no scar afterwards. We actually take out just the individual follicles.
Right, and you put them in that, like what you're saying, this random kind of, but kind of controlled random order.
Yes.
So how long would someone expect, if they had a transplant, how long would it take for them to get like that?
It takes about 6 weeks until you see the hair starting to grow.
Right, so it does take some time. People should understand that. It's not like an instant transplant, but it is very dramatic when it works.
It is. It's wonderful.
All right, next I want to talk about ears, right? Because you guys fix everything. I mean, we talked about everything from head to toe. We might as well talk about ears. And ears stick out. That could be very traumatic for kids, right? You were a pediatrician, Jody.
Definitely, and we like to take care of it before a child hits grade school.
Right, so you want to get in there early because basically because of the teasing?
Yes, the social ramifications are really hard.
Are huge. Okay, so here's an example of someone you took care of. Is this a difficult procedure, Elie?
It requires a lot of precision and a lot of detail, but at the same time, it's a pretty straightforward procedure. The scar is hidden behind the ear, so no one ever sees the scar, and you can just see the confidence in these children when they come in afterwards. It really is wonderful to see because they're so young and they're starting school, and if you can really help them out at that age, it really is very gratifying.
Yeah, especially nowadays with bullying being such a huge thing. I would think when this kid has this done, he's got to be so happy, right?
Definitely.
Yeah. All right, another thing I want to talk about is ear reduction, earlobe reduction. How does this happen? I mean, I never thought of such a thing. How do you get such a big, long earlobe that it needs to be reduced?
You know, part of it is the natural aging process.
Okay.
Everything gets bigger and droopier, but also earrings. Women's earrings are heavy, and they pull down on the earlobe.
And that's what causes this phenomenon a lot of time. Well, here we have a before and after that's pretty dramatic. Again, this is a simple fix?
It is. This can be done in the office with the patient completely awake. They go home, you know, takes less than an hour's time, and it's very straightforward and easy little procedure.
Well, this is going to sound silly. Not only does it look reduced, but also looks younger.
Exactly. And that's really, you don't even pick up on the fact that the droopiness makes it look older, but it does.
All right, so you fix the face, you made that younger. You fix the hands, that gets younger. And now the ears look younger. You guys are amazing. Thanks so much for coming in. Really good to see you again.